My name is Rosie Ingebritson. I'm the program director at the Cancer Support Community in Ann Arbor. You've got my contact info there. I'd love to start with a show of hands of just kind of who we are seeing in the room today. So hands up if you are a caregiver or loved one of someone dealing with metastatic breast cancer. Okay, and hands up if you are a person living with metastatic breast cancer. Okay, hi everybody. So thanks for sharing that. So as we're talking about this, we'll take questions. I'll take questions throughout. So I'll pause every now and then to say any questions so far, but if anything comes up, if you have a question, feel free to just either raise a hand or shout it out, interrupt me throughout. I'd love to have some discussion as we go through this content. The other thing that's important to say is talking about mental health is not always easy. I'm going to be trying to kind of give you an idea of a little bit of the research around mental health and metastatic breast cancer. But feel free to be open if about what you're dealing with and ask questions. If you'd rather share a question privately, you can give a note card to Doreen here. There's 3x5 note cards on the table, so do feel free to do that as well. Okay, so quickly I just want to run through what we're going to be talking about today. So we're going to start with just some of the normal emotional responses to cancer, which will probably be no stranger to the folks in the room here. We're going to talk about depression and anxiety, traumatic stress, understanding your own mental health, signs that it might be time to get some help, and then ways to take care of yourself, and then we'll have some extra time for questions and discussion. But like I said, throughout the presentation, feel very welcome to raise a hand, shout it out. So a few of the common emotional responses when cancer is a part of life, whether you're a patient, caregiver, loved one. Again, none of these are going to surprise you, but I think it's important to just kind of acknowledge all of these things are normal, right? It is not, it is very much okay, and it's normal to feel these things. So I've kind of made a list here. I won't read every single one of them, but things like stress and anger, confusion, grief, denial, loss of hope, loss of control, feeling alone. All of those are really, really normal things to deal with when cancer is a part of your life. What is not on this slide, but I think is also important to acknowledge, is that during a cancer experience, you might find new sources of joy, new sources of hope, things that really do uplift you and create maybe new priorities, new things that you never thought you'd care about. So, we're going to be talking about mental health, and a lot of that has to do with stuff that's challenging. But we know that there are some positives too. I'm not going to be the one to tell you, look for the positive in your cancer experience, but that is part of the picture, and it's important to say that out loud. So I just want to look kind of broadly at mental health and cancer. So depression, anxiety, and traumatic stress are the three sort of diagnosable conditions we're going to be talking about today. So at least a third of patients and caregivers dealing with metastatic breast cancer specifically experience clinically significant symptoms of one or more of these disorders. So I don't love that word disorder because it's very negative, sounds like something's wrong, but the reality is when we're talking about clinically significant symptoms, what I mean is diagnosable symptoms of one or more of these conditions. So also, I should mention, I'm more than happy to send these slides to folks, so if you're frantically taking notes, don't feel like you need to do that. I'm more than happy to send them to you. I can collect your email at the end. Also, feel free to frantically take notes if you prefer. This isn't just about quality of life. Of course, quality of life is really, really important, but I think something that we don't always think about is that your mental illness or mental health actually also impacts your physical health in a really significant way, particularly when you're dealing with cancer. So reducing depression during treatment has actually been shown to improve outcomes from disease. So people are living longer when they're getting the help that they need for their emotional health, their mental health. And this depression study that I'm talking about was specific to metastatic breast cancer. So it's always important to acknowledge some of the barriers to receiving appropriate care for your mental health. We talked about this in my last session, so for anyone who was there, I'm sorry to be repetitive, but stigma around mental health is still very much alive. I think in the last decade or so, it's gotten a lot better. There's more public communication about mental health and how important it is, but I think people still do really struggle with saying, I might be experiencing depression or anxiety, or I just don't feel right mentally. That's why the title of this talk, I'm calling it, I don't feel like myself. Sometimes that's the sign. And we'll talk more about what the signs are later on that you might be struggling with mental health. So in addition to stigma, underreporting is a real issue. When people are dealing with a serious physical illness, or this goes to caregivers too, they're likely to minimize their mental health symptoms. It's really hard when you're going into your doctor and you have 20 minutes with your oncologist and you're dealing with like neuropathy and other physical side effects. You're like, I need to deal with those, right? Because that feels really pressing. But I'm also really depressed, and that's just as important, but it often gets kind of bumped down the list, and you don't always have enough time to address those things. It also doesn't necessarily feel urgent because it's not like I can't feel my fingers. It's like I feel bad, and it doesn't feel quite as pressing, even though it's just as important. And then, of course, it's important to mention that for some folks, getting mental health services, it's just a matter of resources. There might not be appropriate resources in their community. It might not be covered by their health insurance. What's important, though, is if you're in treatment for metastatic breast cancer, it's very likely that you have an oncology social worker accessible through your medical team who can either do some short-term counseling or refer out to get you the services that you need. So don't worry about asking for that if you need it. Any questions so far? All right. So, depression and anxiety are often seen as kind of the two most common mental health issues affecting people dealing with cancer, kind of across the board. So I'm talking about them together because they very often present with mixed symptoms, meaning you might have a diagnosis of depression and also some anxiety symptoms. You might have a diagnosis of both. You might have anxiety with an occasional depressive episode. They are like peas and carrots. They just go together, unfortunately. So, we're going to talk about them together, but we'll also talk about symptoms of each. You don't necessarily have one if you have the other. Depression and anxiety are more common in people receiving chemotherapy. So that felt really important for folks living with metastatic disease. You can be on chemotherapy for a long time. You all know this, or other drugs that are really similar to chemo that you're on for months or years. And so knowing that that's a risk factor, I think, is really important. There's other risk factors as well, things like socioeconomic status, where you live. There's a lot of different factors, but the important thing is folks dealing with metastatic breast cancer are likely to experience these things at one time or another. It is normal. It's just something that should be addressed like any other medical symptom. And this goes for caregivers too. We've got some caregivers still in the room here, and it's really important. We will actually talk about that, but caregivers experience the same symptoms of mental health at actually the same rates as patients. And that's, I think that surprises some people, but it's really, really important to know. Okay, so these are the symptoms of depression. I'm going to walk through them, and you'll see that I have some highlighted in red, and I'll explain why in a moment. But this is from, I've kind of changed the wording around so it's a little bit less clinical, but this is from the DSM-5. You guys may have heard of that before. It's the Diagnostic and Statistical Manual of Mental Illness. So this is, if you go into a therapist's office and you're like getting a diagnosis, this is the manual that they're using for it. So symptoms of depression: depressed mood, feeling sad, empty, or hopeless, reduced interest in or pleasure in activities, weight changes, sleeping changes, feeling restless or slowed down, fatigue, feelings of worthlessness or guilt, changes in thinking and concentration, and recurrent thoughts of death or suicidality. Does anybody can guess why certain ones are highlighted in red? Yes, exactly. Yes, the answer was because those are also things that have to do with treatment. So in all of the mental disorders that we're going to talk about, I've highlighted the symptoms that are also caused by cancer treatment or cancer itself. So I'm sure a lot of these, yeah.
What if your caregiver, meaning my spouse,
yeah,
experiences these?
Yep. So that would be pretty sort of textbook symptoms of depression. That's not to say, I'm not going to diagnose anybody today, but just spoiler alert. Yeah, we're not doing medical care here. But so the diet. So you're going to diagnose somebody. That's up to you. So basically, the diagnostic criteria, and again, don't diagnose your loved one. I'm not going to diagnose you or your loved one, but leave it to a mental health professional. But the diagnostic criteria for depression would be 5 or more of these symptoms present during the same 2-week period, and representing a change from previous functioning. So like something like slow affect, feeling slowed down. Some people just have a slower affect. Like that wouldn't be a symptom unless it's a change, right? And it has to include one of those top 2. You have to have at least one of those top 2. So The reason, so another interesting thing about DSM criteria for depression and other mental illnesses is that if the symptom can be attributed to a different illness, it doesn't count. So that makes me think this is probably way underdiagnosed, right? Because if you're irritable, we're getting into anxiety, but let's say you're having changes in thinking and concentration. Maybe you've got chemo brain, right? But you also maybe are depressed. And so you don't know which one is causing it, right? But it's still a clinically significant symptom. So sometimes it can be hard to really make to narrow in on a diagnosis when you've got all these physical changes that can affect things like cognition and affect and weight and sleep and all that stuff. So it's tricky is what I'm getting at. Any questions on depression specifically? We'll have more time too. Okay, so symptoms of anxiety. And like I said, these often, like you might have 3 from depression, 3 from anxiety, or something like that. So symptoms of anxiety would be excessive worry, difficulty controlling worry or fear. So even though I didn't highlight they're not physical symptoms of cancer, I think they're pretty much universal emotional symptoms of cancer, so that's important to acknowledge too. Feeling edgy or restless, fatigue or tiring easily, changes in thinking and concentration, feeling irritable, shout out to steroids, muscle aches and soreness, and difficulty sleeping. So a bunch of these too are, same deal, right? Like they might be very easily caused by treatment. Excessive worry, so the diagnosable criteria for this would be excessive worry specifically for more than 6 months, most of the time. So like kind of feeling anxious more often than you're not. Plus at least 3 of the physical symptoms. But literally all of the physical symptoms could be caused by cancer treatment. So again, dicey, tricky stuff, right? Any questions here on anxiety while I take a sip of water? That's a really good question. Yeah, so the question for the folks on the webinar was, if you don't have this for 6 months or 2 weeks straight or anything like that, if it comes and goes, like when you're feeling physically unwell, maybe you have symptoms of anxiety or depression, is that diagnosable? It would depend on the extent of the symptoms and the person and your baseline. But sometimes you could say, you're having depressive symptoms. You're having maybe a depressive episode. So that might be if it lasts, for a prolonged period of time, but it's not like years. It might be weeks or months. But if it's, from day to day, you might not have, like if you went into a mental health professional, you might not then be diagnosed with major depressive disorder or anxiety, generalized anxiety disorder. Those are kind of the two, like those are what the formal names of those two are. What you might be diagnosed with is something like an unspecified anxiety disorder. So it's not like one of the specific ones in the DSM, but you're still dealing with an anxiety disorder. You're dealing with like episodic anxiety. Does that make sense? Another question? Yes, great point. So someone just mentioned that this all heightens, particularly anxiety, I think, when scans are coming up. That's so true, and that's why, has everybody heard the term scanxiety? Yes, such a real thing. And I mean, so sometimes this stuff is situational, but that doesn't mean the symptoms aren't real. So that's so tricky, right? Like you're anxious, and it makes sense that you're anxious. You have a scan approaching. Like everything about that is logical. So when we're talking just about mental health and cancer's not in the picture, a lot of this is like, this is happening and it's excessive, right? Excessive worry. It means like, it doesn't necessarily, like your situation doesn't necessarily fit with the level of worry that you're experiencing. But when you're dealing with cancer, it kind of makes sense to be super worried, right? Especially when you have a scan approaching. Like that is logical stuff, but that doesn't make the symptoms any less significant. So that doesn't necessarily mean that you don't need treatment for those symptoms. I'm not necessarily talking about medicinal treatment, although we will talk about that as one option, but it might be there's therapy or support groups or all kinds of other things. So when I say treatment, I'm talking about that big umbrella term. I'm not necessarily saying we're getting on a medication for this, although you might. Does that answer, or actually I guess it wasn't really a question, just a really important thing to acknowledge. Scanxiety is real, and actually that comes back to your question too. There's going to be periods where things are really, really hard, periods where things are like kind of okay and you've found this new normal and you feel kind of comfortable in it. So that's all normal when dealing with cancer, but it makes it a lot trickier to get a good beat on your mental health.
And then communicating to your loved one that, hello, this is what's going on.
Yes, super important as well. So another comment, being able to communicate this to your loved one and say, hi, this is what's going on with me mentally. Chances are it's going on with them mentally too, but you're expressing it in different ways. And I'd be happy to send you my caregiver workshop slides too to talk a little bit about communication. It's not an easy thing because you're going to cope differently. Your coping strategies are probably different, and the way that you express anxiety, depression, and these symptoms is probably really different because you're two different people. So, it's going to come out differently, and that can lead to conflict. And yeah, I'm sure I see some nods in the room. I mean, I think that's just an unfortunate reality of this is when we're talking about something like mental health, it's not as quantifiable as something, I keep coming back to neuropathy just because that's a common side effect. It's not as quantifiable as that, right? Like my neuropathy is affecting my hands, it's affecting my feet. Like that is very specific and easy for someone to understand. But mental health, one person who's anxious might disconnect from loved ones, spend a lot of time kind of obsessing, worrying on their own. Someone else may start acting like a real so-and-so, like being real, like really irritable and all that stuff. So, and those are both valid expressions of symptoms of anxiety, but they don't go together very well. And that's really normal too. So now I want to talk about traumatic stress. Which, again, we talked about in our last workshop, so sorry. But traumatic stress is something that I don't think people necessarily consider. I think we hear a lot about depression and anxiety as, I would actually argue that those should be considered symptoms of living with cancer or being a caregiver for someone living with cancer. Traumatic stress is one we don't think about as much because I think when a lot of folks think about traumatic stress, they think about, we're talking about PTSD, post-traumatic stress disorder, or PTSS, which is post-traumatic stress syndrome, which is sort of the lesser version. PTSD is something we usually associate with a traumatic event, so something like going to war and experiencing a lot of violence, or maybe witnessing or being involved with like a bad car accident. But in truth, cancer is a trauma in itself. It's a different kind of trauma because it's not a singular incident. It's something that unfolds over time and potentially has sort of smaller moments of trauma throughout it, but it affects people in much the same way. And so that's something that people are not always aware of, but clinically significant traumatic stress symptoms are more common in people diagnosed with cancer than in the general population. And within that group, additional risk factors for traumatic stress include being on chemotherapy, younger age, and prior trauma. So you come into a cancer experience or a caregiving experience with all that baggage that you already had, right? All that stuff doesn't go away when cancer enters the picture. So if you were anxious before, you're likely to be more anxious once cancer enters the picture. If you've had a trauma in your past, that's likely to be exacerbated by experiencing this additional trauma of being diagnosed with cancer or having a loved one diagnosed with cancer. And I keep mentioning caregivers because it's really important to note that caregivers and loved ones of people diagnosed with cancer are equally likely to experience symptoms of traumatic stress, so PTSD or PTSS, as patients themselves. I think that's pretty surprising and really significant. So here are some of the symptoms of traumatic stress. Intrusive thoughts, memories, or flashbacks. So I think flashback makes you think again of this like singular incident, but this might be things like, just kind of obsessing and being unable to stop thinking about the what ifs. And that could also be confusable with anxiety, but it's that, you can't stop thinking about it. Nightmares. So cancer is creeping into your dreams. Emotional or physical response to reminders of trauma. Sometimes people hear about, if you're someone who deals with a lot of nausea and vomiting during chemo, which thankfully is less common than it used to be, but still does affect some people. Some folks will feel nauseous or vomit on their way into the hospital, even before they've had chemo. So that would be an example of this, like a physical response to a reminder of the trauma. Avoiding possible reminders of the trauma. So just not wanting to talk about it because you're afraid of how it's going to affect you. Inability to remember details, feeling isolated, reduced interest in activities. Again, it's kind of a depression thing too, so you'll see how a lot of these things overlap. Exaggerated blame of self or others for causing the trauma. We see that a lot in oncology, folks being like, what did I do wrong to be here? And the answer is nothing, but it's impossible to get your mind around that. overly negative thinking or sort of a doom and gloom mentality, a negative affect, which would be like a slow or sort of doom and gloom like presentation, to others, hypervigilance, so things like looking out for changes in symptoms in a way that's that's not necessary, like any little ache or pain, maybe feeling like, oh, I have to go to the emergency room. And then there's only a few on here that I think are, sort of physiological symptoms. Irritability or aggression. Again, I would mention steroids. A lot of people have steroids with their chemo or other treatments, and you might, experience this for a few days after. Difficulty sleeping and difficulty concentrating. Again, kind of classic chemo side effects. Any questions on traumatic stress? Yeah. Yep. The question was, can you have traumatic stress and have it kind of sneak up on you? I would actually say that's almost like a trademark traumatic stress thing, is that it is, once you start treatment for it, you're going to be more aware of it, right? But usually it does kind of come out of nowhere. Like, you walk into the cancer center for a scan and you have a panic attack, and you didn't expect that one bit because you've been to the cancer center tons of other times, but maybe it was the 1-year anniversary of your diagnosis. Maybe it was something else in your life that was exacerbating your anxiety going into that moment. So yeah, absolutely, it can sneak up on you. I would argue that any mental health symptoms can kind of sneak up on you because most people aren't constantly self-analyzing. That's what therapy is for, right? You're just getting, especially when you're in crisis mode, when you're dealing with a metastatic breast cancer diagnosis, you're getting through the day-to-day. You might not be pausing to reflect, like, how is this making me feel? What are the changes in my, my mood and thinking and all those things? And we're actually gonna get to that next. Any questions while we're on traumatic stress? So understanding your own mental health, I would say, is the first step to figuring out if something's really wrong. And again, I keep saying, like, if something's really wrong, time to get help, all this stuff. But I will mention again, all of this is normal. It might be something that needs addressing, but it is a normal symptom, a normal reaction to dealing with cancer. So even if you do need help, even if it is something that we would say is a significant symptom that we're worried about, that's not to say it's an abnormal or like inappropriate response. It's just kind of is what it is. So knowing your baseline, I talked before about, that these symptoms have to represent a change in a person. So if you're someone who's normally sort of more on the like doom and gloom view of life, that might just be who you are, and that's okay. But if you went from being a super duper positive, look at the bright side kind of person to suddenly not being able to see the bright side in anything, that might be a sign that something's a little, that something's wrong. Try keeping a symptom diary. I think this is one of the most helpful things that you can do in understanding your own mental health is write down, when you're feeling bad, write down, okay, where am I? What was happening? Is there like something that immediately prompted this? And try to do it when you start feeling bad. That's hard because especially if you're dealing with something like depression, sometimes you're feeling bad for hours, days, weeks, months before you quite realize that you are. But if it's something like particularly anxiety or panic attacks, you might be able to say, okay, I'm feeling really anxious right now. Like my heart rate is elevated, I'm sweating, what's happening? And where is it coming from? And things as simple as like, are you at home on the couch? Are you at the cancer center? Are you walking with your friend? Like what's happening when that happens? Know your bother factor. So I learned this from, I actually just heard this on a podcast with a physician that was really good. I like this term though, bother factor. So it's essentially like a scale of like, how much does this affect me? Like, am I willing to live with this? Like, what's the extent that I'm willing to deal with? So is it, okay, I have anxiety every time I go into the cancer center. I have found ways to self-regulate and breathe through it. And so, yes, I can tolerate it. Or is it maybe those same exact symptoms, but for you, that's enough to say, I need extra help. Like this, I can't deal with having an elevated heart rate and sweating when I go to the cancer center. And that's fair. So everybody's bother factor is going to be different. It just depends on kind of what your limit is. And so knowing what your limit is really important in assessing when you might need to go get some help. Turning to loved ones, I mentioned that with some of these mental health diagnoses, it can be really hard to notice on your own that you've changed. So asking loved ones, and also being not so afraid to tell your loved one if you notice something in them. It's not easy, but that can be the ticket for someone realizing, okay, I need to get extra help because this person who knows me so well, they've known me for years, they know my baseline and they notice something different. That can be everything. So you can sometimes ask, like people aren't always comfortable telling you that, but if you suspect that maybe you might be dealing with some mental health challenges that you weren't before, ask your best friend, ask your partner, ask your mom, your sister, whatever. That can be a really helpful thing. So also being honest with yourself and others, I think is just essential, especially in communicating about this stuff. And asking for help when you need it is the most important thing. So we're going to talk about signs that it's time to get help, like kind of nowish. So signs that it's time to get help. You feel bad more often than you feel good. That we talked about that, and I know there's this big scary disclaimer at the bottom of this. We're going to get to it. It is just really important. I know it's kind of like, whoa, that's in red. In fact, let's start with it so we can just cross it off our list, right? This is really, really important to say, though, anytime we're talking about mental health. If you're ever thinking about killing yourself, hurting yourself or others, go to the emergency room. Do not wait. Either call 911 or get someone to take you straight to the emergency room because that is a sign that something is really wrong. And that is the best place, like calling 911, using emergency services, like that's the next step of, like that's the next level of get help we're talking about right now, right? Those are the times that you're gonna need to get help in the moment. Same is true if you witness suicidal ideation in a loved one, call 911. Don't hesitate, just do it. It is the right thing to do. So, okay, we're done with that scary stuff. Let's go back to signs that it's time to get help when it's not an immediate thing. So you feel bad more often than you feel good. We talked about, in some of these, the diagnostic criteria would be like for a period of 2 weeks with a depressive episode or for 6 months or more. But I think a good way to self-analyze is just to say, do I usually feel bad? If yes, it's time, right? If your mental health is interfering with your day-to-day life, just being able to get things done, if you're still working, if it's stopping you from being able to be effective at work, if your relationships are suffering, and then if it's affecting your ability to adhere to your cancer treatment. We've seen a lot in the research that shows that depression, I think this contributes to what I talked about before in terms of outcomes being affected by mental illness. Folks who are experiencing clinically significant depression, anxiety, and other mental illness are more likely to have trouble adhering to their cancer treatment. So more likely to, to struggle to stick with their chemo and continue with what they need to be doing. So coming back to our little disclaimer for one moment, I do think it's important to acknowledge it's normal to think about death or dying when you're dealing with a serious illness. Thinking about and talking about those things is actually okay. It's actually part of this process. Suicidal ideation is the other side of that. And so knowing the difference is really important. Do I have any questions on this slide? Okay, so let's talk about how to take care of yourself. I mentioned before medication. A lot of people dealing with cancer and or dealing with caregiving issues, any kind of chronic illness, do add an antidepressant to their treatment regimen. I would argue that it is part of your cancer treatment. Again, it's a personal choice. I'm not saying this is something for everybody, but it can be really a helpful tool to help you reestablish a baseline that's comfortable for you. It's important, obviously, to make sure that it's one that's safe to use with your current cancer treatment. There are some that aren't and many that are. So the way to deal with that is to just talk to your oncologist, your treatment team, and say, hey, I'm struggling with these symptoms. I think I might be depressed. They might send you for an evaluation. But they can probably find an antidepressant or an anti-anxiety med that fits with your treatment and isn't going to cause any danger. Either in tandem with medication, or if you prefer not to use an additional med, therapy and counseling can be really beneficial for some of these things. So that might be short-term or long-term counseling. There's certain counseling or therapy sort of methods that can be really, really helpful in treating depression and anxiety. CBT, it's cognitive behavioral therapy, is a common one for these. So you may be able to see someone privately if your insurance covers that. Some insurance plans cover like 6 or 8 sessions. Others cover, significantly more ongoing counseling. Your oncology social worker is also a good resource for this. Whether or not they provide counseling one-on-one, they should be able to help you find the resources that you need. I also am an oncology social worker. I'm more than happy if anybody wants to stay after. If you're looking for mental health, counseling resources, things like that, feel free. I'm more than happy to talk with you. I'll take my mic off so we can talk privately. So support groups are also a really good option. I see some nods. I hope some folks in the room have utilized these already, and if not, I would definitely encourage you to think about it. They're not for everyone, but I think for most people they can add a real benefit to your coping with cancer. So I'll take a moment and plug the cancer support community where I work in Ann Arbor has support groups for caregivers and people with cancer. We actually have a metastatic cancer specific support group, which I think is really important, and I think the folks in it are like half metastatic breast cancer patients at the moment. So certainly folks would be welcome in that. We also have caregiver support groups, as I mentioned. We have sister organizations. Yeah, no problem. Yeah, so we had some really good points in the room about, so the question was, I'm gonna try to backtrack through everything we just talked about. No, it's okay. So the question was like, what's the typical breakdown of support groups, patients versus caregivers, different diagnoses, et cetera. So it depends on where you go. At the cancer support community in Ann Arbor, we have patient-specific, so like our metastatic cancer support group is people living with metastatic cancer, no caregivers, it's just people diagnosed with metastatic cancer. It's all different types of metastatic cancer, but quite a few are MBC, folks living with MBC. We have caregiver groups that are specifically to caregivers. We also have a couple and care partner group, so for the person with cancer and their primary person to help with communication. So if anybody could use that, talk to me after. We have groups that are mixed, so patients and caregivers together, but more open forum. So we try to create different spaces for different needs. And that's usually going to be the case. It's different if you live in a smaller community, particularly if you're in a rural area, there's going to be fewer resources. That I think we talked way earlier on about how geographic location can be a risk factor for certain mental illness. I would argue that is definitely part of the problem, right? There's fewer resources in certain communities. So we're actually working on getting our programs further out from Ann Arbor. So we now have programs in Chelsea, Brighton, and Canton as well. So we have like a chunk of Southeast Michigan. So that's to spread. So we've seen folks from like the rural areas in northern Livingston County. We see folks in Chelsea from as far as Jackson. So I think now that mental health is being seen as like a critical component of cancer care, I think there's going to be more opportunities opening up. But yeah, if you're looking for something in your local community, talk to me after. I'd be happy to see what I can do. And hopefully there'll be something. I think that sort of summarized what we just talked about for the folks on the webinar. I hope so. So jumping back into a few more things. I was going to mention our colleagues in Royal Oak and Grand Rapids. There's Gildas clubs in both of those locations. That's the same organization as us on a national level. So they're wonderful. They do all the same things, various different support groups. And again, even if you're not like in my service area, I would be more than happy to work with you and figure out what's in your local community. So mindfulness and meditation are really helpful tools to help manage things like depression, anxiety, and also symptoms, actually. So there are mindfulness and meditation groups available, sometimes in the Cancer Center, definitely at cancer support communities and Gildas clubs. There's also apps. So if you don't live near a place where you can go to a mindfulness or meditation class, two that I would recommend based on experts in this area recommending them to me are Headspace and Insight Timer. Headspace, they're both free to download. Headspace has more available if you pay, but I think they do reduced, like if you have a cancer diagnosis, I think they have a reduced rate. Insight Timer, I think, is free and has more free content. Exercise. So this is really, really tough when you don't feel good, either emotionally or physically. That said, there are ways to get some physical activity that can actually really help with mental illness symptoms and physical symptoms. So something like a gentle yoga class, again, that might be available at your local cancer support community, Gildas Club, or your cancer center, or even just like taking a gentle walk, if you're physically able to do it, can make a huge difference. That also gives you an opportunity to be in some sun, for a few more months, maybe another month at best. But even if it's the sun through the gray sky, it's better, to just kind of get out there, get that little bit of vitamin D. So creative expression is also really important. So if that's something that resonates with you, going to an art workshop, doing something like, making music, writing, I'm talking about journaling and storytelling as well, has actually been shown in the research to write about your experience and tell your story to help with managing just overall coping for cancer. There's some flyers on your table about a workshop that we actually have coming up in Ann Arbor. That is specific to metastatic breast cancer. It's going to be a workshop with a Pulitzer Prize-winning journalist, Michael Vitez, to do, it's going to be like writing prompts to help you write down and tell your story, and that's yours. It's not going to be shared anywhere, but people can share it in that space and kind of use this as a way to empower yourself through telling your story. It's a really cool program. I'd be happy to tell you more about it after. And it's free, like everything we do. Finally, I just think it's important to remember that you're not alone in this. It's normal to struggle with mental health. It's a third of people dealing with cancer are being diagnosed with one of these things. And that same third reflects metastatic breast cancer specifically. So it's normal, but it's significant too. It's important to deal with it. The most important thing you can do is reach out and ask for help, whether that's your loved one, your social worker, your support group. Tell somebody that you're struggling. And if you don't know if you're struggling, ask your person and see what they think. So that concludes the formal content. I've got a little bit of time for questions and discussion. I also want to mention, this is my reference slide. If anybody wants a copy of this, like I said, the slides, I'd be happy to send it to you. You can also check out, if you're interested in like the academic papers that contributed to this. Some of them are more boring than others, but the content is really good. So you can certainly check that out. Okay, do we have questions? What time do we have until?
We've got until 12:25.
Okay, so we got about 15 minutes. I also would be curious if this really resonated with you, if something surprised you, nothing surprised you? I said if something surprised you, and I saw a real head shake. Yeah, really good question. So we just got the question, is there a resource online that helps you find a therapist who knows what they're talking about when it comes to dealing with cancer, and particularly metastatic cancer and the challenges that brings? Yes. So one thing I would do first before digging around online is ask your medical team, because they may know someone specific who they can say. So like for instance, in Ann Arbor, I have a list of folks that I know personally as colleagues that I know they're good. And I can say, start with these people. If none of them take your insurance, come back to me. And then what I do, if none of them work out, is I use a database on Psychology Today, and you can do that too. So if you ask your medical team and they're like, well, I don't know, sorry, good luck, check out Psychology Today. There are filters on it so I think it's just psychologytoday.com. There's filters on it, and you can pick cancer, chronic illness, depression, anxiety, et cetera, and anybody who has flagged that as a specialization of theirs will come up. So I actually find that the easiest way to do that, this is kind of a silly roundabout internet trick, is to Google Psychology Today, cancer therapist, wherever. And that's going to automatically, you'll click on the link and it'll have everyone who tagged cancer. That's just easier than using the inside of the website, I find. But cool, absolutely. And also feel free to email or call me. I'd be happy to help you search. Yeah. Yeah. I completely agree. Yeah. So that was a comment of someone who said they're surprised that only a third of cancer patients deal with these things. So a third that we know of, right? So think about how often these things go underreported. We talked about the fact that people are minimizing mental illness symptoms because they have such serious physical symptoms going on. So I often help when someone comes into my office and says, I'm anxious, I don't know why, and they're kind of getting down on themselves for it. I always say, I think that depression and anxiety should be listed under side effect or symptoms and side effects of every single cancer across the board, because everyone dealing with cancer will deal with at least some brief episode of one or the other of those things, right? So a third are the people who are diagnosed. So they're dealing with clinically significant symptoms, and they were able to actually get that diagnosis, right? So also this is a study, right? It was a meta-analysis, meaning it took various studies and put them all together to see what the overall number was. But that's still not actually, we haven't asked every single cancer patient in the world, right? So yes, you are right, it is surprising, and I think it's probably not an accurate statistic. Other questions, comments, concerns? That's a really good question. So the question was what to look for in children. You're right, children present really differently with mental illness. I think probably the number one thing to look out for is like significant behavior changes. A lot of kids, when dealing with a diagnosis of a parent or close loved one, it's really normal to have some regression. So, if you have like a 8 or a 10-year-old who's very much doing their own thing, they're out playing with their friends, they're like not wanting to, spend tons of time with their parents, and at that age, it's really normal for a kid that age after a cancer diagnosis to like be more attached to their parents, to to want to maybe sleep in their bed, or some kids. So when we say the word regression, it basically means like age and regression in sort of their like developmental milestones. So that's a good sign. It's normal, but it's also a good sign that something might be wrong. A lot of kids will act out. They don't have the language to describe what they're feeling. So, when we talk about irritability as something that's just from anxiety, in a kid, feeling like being irritable or having outbursts or tantrums are really, really normal things that might be a sign that they're dealing with symptoms of any one of these things or something else. I would say if you have kids in the home and you're dealing with and there's cancer in the family, definitely look for resources for those kids in your community. There might be, like, we offer a support group, a weekly like exercise and stress management class for kids. We do social events and things like that for kids. So if you have a local CSC or Gilda's club, there might be something. If not, finding an individual counselor, I think, is a huge, important thing to do for those kids. We also have some really good written materials on how to communicate with kids about cancer. If that's something you're interested in, I'd be more than happy to provide that. But I would say that something really important to do in the home, if you start noticing these kinds of signs in your kids, grandkids, nieces, nephews, is to have open and honest conversations and to invite questions, as opposed to keeping secrets. And I could do a whole other presentation on talking to kids about cancer, but seriously, if anybody is worried about that, interested in that, feel very free to reach out to me. I'd be more than happy to like talk on the phone if you don't live in the area and kind of strategize, because that is a really, really tough thing. It's a whole different ballgame in terms of mental health. I just saw my 10 minutes sign, so thank you. So we do have time for a couple more questions if anybody has anything, or just comments about your own experience. Yeah. So we have a program that we do also in Ann Arbor called, it's an acronym, FOCUS, but it's Facing Cancer Together, essentially, for couples and care partners. So the person diagnosed with cancer and their person. And it focuses on communication and coping sort of as a team. That is something, I talked about this a little bit in my last workshop on caregiving, but so working together as a team, taking this we approach to coping with cancer, can improve mental health and coping outcomes for both the patient and the caregiver. It makes everything easier. But it's not easy to do naturally because you're two different people and suddenly you're coping with the same thing, but you're coping in your own ways. All of that is normal. So couples and care partners enter the cancer experience with all the issues they came into it with. Like, no couple is without any issues, right? And then cancer comes into the picture. I see couples looking at each other like, we are, which is great. I hope you are. But you enter, cancer enters the picture, and all those little communication breakdowns, those normal things that push each other's buttons, they don't go away. And you have to learn to work around them and to communicate with each other when there's this huge elephant in the room all the time, right? So this program is awesome. It's a 5 or 6 weeks, depending on scheduling and who's enrolled. And it has it's a little bit more curriculum based. So most of our support groups are just like open forum. There's a facilitator. I facilitate some of our groups. Other social workers as well do our other groups. But otherwise it's just kind of, what do you need to talk about? Let's talk about it. Might ask some prompting questions. Whereas the couples group, sorry? It's not at U of, it's at the Cancer Support Community in Ann Arbor. Yeah, but it's not one-on-one, but it's small groups. So it's either, we've done it with as small as 2 couples, as big as 4. I wouldn't go much bigger than that. So it is a lot more kind of one-on-one, or 1-on-4, whatever, attention. That's a good question. If your partner is guarded, would you recommend an even smaller group? No, I think the size of the group and the nature of the program lends itself to open communication. I would say if your partner is guarded, I would recommend this program. So I have the privilege of facilitating this from time to time, and I've seen amazing growth in terms of people who are afraid to open up, or who it's just not their nature. Like they're just, internal processors, they're quiet, they're just not used to talking about their emotions. This program will gently, I don't want to say force, will invite open communication, but it also it's structured. There's a curriculum to it. So for someone who's like, we often see one of the partners or the other is like, I would never want to go to a support group, but they come to this thing because you're going to learn, there's a binder, there's an agenda. It's like more accessible. It's not just like, hi, come talk about your feelings. Here's an open stage, right? So it's a really great program. We'd love to have any of you. It is in Ann Arbor, but I would say, it's a limited time series. It's just 5 or 6 weeks. So I would argue that it's worth making the trip, but it's up to you. Yeah. It's a good question. The question was, is this couples program or couples and care partners program a novel thing that's unique to our community, or is it something that's more accessible? So this specific program is actually quite unique. It was developed in partnership by our organization in partnership with the U of M School of Nursing. It's being offered at some cancer support communities around the country, and I think it's going to continue to disseminate and be more utilized in like local cancer centers and things like that. But it is. I don't know off the top of my head whether either of the Gilda's clubs is doing it. I don't think so, but I don't want to speak for them. Can't hurt to call them, they're great people. But I can say we definitely are doing it in Ann Arbor. One thing we do is if we have people with similar diagnoses, we'll try to get them in the same group. It does work across disease types and stages, but like we typically try to put couples and care partners dealing with metastatic disease with others in the same situation, and people with early stage disease maybe in a different group. Yeah, if we've got enough interest in this room, maybe we can like get a series going. I'd be happy to do that. So the other thing that's important too is I wouldn't necessarily recommend this program for a couple that is dealing with like really significant marital distress at this moment. I might say try couples counseling first. So if you're a couple that is like, we're doing fine, but also not everything is perfect at every moment, this is a great program. So it's not couples counseling. It's really focused on communicating around cancer specifically. And I keep saying couples, we often have non-romantic care partners in the group too. So adult child and parent, siblings, best friends we've had. I mean, it's not only romantic partnerships, because that communication stuff isn't actually like an essential component of a it's not only romantic partnerships. Any other questions? We have like time for one more small one. No? All right. Well, I'll be here for a little bit if anybody wants to talk about resources. If anybody's interested in this narrative medicine workshop, it seems like we haven't done it before. It's like a one-time thing, and it seems like it's going to be really, really special. I have a sign-up sheet here if anybody wants to sign up. Be happy to do that. I don't know if caregivers are going to be able to participate in the workshop, but we will have a space for caregivers who are there, and if we have enough of them, we might even like facilitate a little support group or something like that. So caregivers are very much welcome at the event. So thanks, everybody. It's a pleasure talking with you today.
Thank you.
Sure.